Hi everyone. I'm Dr. Shin-Young Yim, Pediatric Rehabilitation Medicine, Jeju University Hospital, South Korea. Today, I will tell you about the causes, diagnosis, and management of a rare disease called Beckwith-Wiedemann syndrome. In video 157, I talked about the symptoms and prevalence of a Beckwith-Wiedemann syndrome. Doctors suspect Beckwith-Wiedemann syndrome when a newborn baby weighs quite a lot with a large tongue, umbilical hernia, and low blood sugar. The genetic causes of Beckwith-Wiedemann syndrome are complex. BWS usually results from the abnormal regulation of genes in a particular region of the short arm of chromosome 11 called 11p15.5. At least 5 genes are involved in Beckwith-Wiedemann syndrome. This picture shows these 5 genes such as H19 imprinted maternally expressed transcript, IGF-2 insulin-like growth factor 2, KCNQ1 potassium voltage-gated channel subfamily Q member 1, KCNQ1 OT1 KCNQ1 opposite strand antisense transcript 1, and CDKN1C cyclin-dependent kinase inhibitor 1C. Chromosome 11p15 is an imprinted region. 3 red genes such as H19, KCNQ1, and CDKN1C are active only when inherited from the mother. 2 blue genes such as IGF-2 and KCNQ1 OT1 are active only when inherited from the father. What is genomic imprinting? People inherit 2 copies of their genes, one from their mother and one from their father. Usually, both copies of each gene are active, or turned on, in cells. In some cases, however, only one of the 2 copies is turned on. Which copy is active depends on the parent of origin. Some genes are normally active only when inherited from a person's father. Others are active only when inherited from a person's mother. This phenomenon is known as genomic imprinting. In genes that undergo genomic imprinting, the parent of origin is often marked, or stamped, on the gene during the formation of egg and sperm cells. This stamping process, called methylation, is a chemical reaction that attaches small molecules called methyl groups to specific segments of DNA. These molecules identify which copy of a gene was inherited from the mother and the father. The addition and removal of methyl groups can be used to control the activity of genes. Only a small percentage of all human genes undergo genomic imprinting. Researchers are still determining why some genes are imprinted and others are not. They know that imprinted genes tend to cluster together in the same regions of chromosomes. 2 major clusters of imprinted genes have been identified in humans. One is on the short arm of chromosome 11 at position 11p15, and another is on the long arm of chromosome 15. While 11p15 is related to Beckwith-Wiedemann syndrome, the region 15q11 to 15q13 is associated with Prader-Willi syndrome. I talked about Prader-Willi syndrome in videos 110 and 111. Chromosome 11p15.5 has 2 imprinting cluster regions known as imprinting center 1 and 2. Several imprinted genes are in these regions. These genes include H19, a gene that signals not to grow, IGF-2, a gene that signals to grow, KCNQ10T1, and CDKN1C, a gene that signals not to grow. H19 is a long non-coding RNA thought to play a role in inhibiting growth. IGF-2 is a growth factor. CDKN1C is a cell cycle regulator and tumor suppressor. Researchers believe that the paternally expressed genes promote growth and that the maternally expressed genes act as tumor suppressor genes or inhibit growth. Typically, H19 and CDKN1C are expressed from the maternal chromosome. IGF-2 and KCNQ1 are expressed from the paternal chromosome. Improper methylation in the BWS critical region can lead to an imbalance of the grow and don't grow signals, leading to overgrowth. Gain of methylation at imprinting center 1 occurs in about 5% of patients with BWS. This leads to decreased H19 expression and increased IGF-2 expression. Loss of methylation of imprinting center 2 occurs in about 50% of people with BWS. This leads to increased KCNQ10T1 expression and decreased CDKN1C expression. Imprinting errors may also be caused by a chromosomal abnormality known as uniparental disomy (UPD). UPD occurs when a person receives both copies of a chromosome or part of a chromosome from one parent instead of receiving one copy from each parent. Approximately 20% of people with BWS have UPD. In BWS, both copies of chromosome 11 are received from the father, ending with paternal uniparental disomy. As a result, there are too many active paternally expressed genes in this region, and more maternally expressed genes are needed. The 5% of BWS is caused by loss of function of CDKN1C. This shows the summary of genotypes of BWS. 50% of loss of methylation in imprinting center 2, 5% gain of methylation in imprinting center 1, 20% of paternal uniparental disomy, and 5% of loss of function of CDKN1C. Inheritance of Beckwith-Wiedemann syndrome. In about 85% of cases of Beckwith-Wiedemann syndrome, only one person in a family has been diagnosed with the condition. These are called sporadic cases. Another 10 to 15% of people with Beckwith-Wiedemann syndrome are part of families with more than one affected family member. In most of these families, the condition appears to have an autosomal dominant inheritance pattern. Autosomal dominant inheritance means that one copy of an altered gene in each cell is typically sufficient to cause the disorder. In most cases caused by CDKN1C gene variants, individuals with Beckwith-Wiedemann syndrome inherit the genetic change from their mothers. Diagnosis of Beckwith-Wiedemann syndrome. BWS shows loss of methylation on imprinting center 2 in 50% or gain of methylation on imprinting center 1 in 5%. In the left picture, the normal methylation status on imprinting center 2 shows two bands indicating maternal methylation and paternal unmethylation. BWS shows loss of methylation on imprinting center 2, ending with only one band, indicating maternal unmethylation. In the right picture, the normal methylation status on imprinting center 1 shows two bands indicating maternal unmethylation and paternal methylation. BWS shows a gain of methylation on imprinting center 2, ending with only one band indicating maternal methylation. When clinical features indicate BWS, such as overgrowth, abdominal wall defects, macroglossia, and neonatal hypoglycemia, recommended first-line testing assesses DNA methylation and copy number variation of the BWS region. When DNA methylation and copy number variation of the BWS region show normal, CDKN1C gene sequencing is conducted to confirm the loss of function of CDKN1C. Cancer risks of Beckwith-Wiedemann syndrome. BWS is an overgrowth syndrome, where overgrowth can occur in specific cells or organs, ending in cancer. The cancer risks of Beckwith-Wiedemann syndrome vary depending on BWS's genotypes, especially BWS with a gain of methylation in imprinting center 1 and paternal uniparental disomy show increased tumor risk up to 28% and 16%, respectively. Mutation of CDKN1C also shows an overall cancer risk of 6.9%. BWS with loss of methylation in imprinting center 2 shows a 2.6% overall risk of cancer. Associated tumor in BWS is usually embryonal tumor such as Wilms tumor, neuroblastoma, or hepatoblastoma. Risk factors of Beckwith-Wiedemann syndrome. Assisted reproductive technologies include all fertility treatments in which either eggs or embryos are handled. In vitro fertilization embryo transfer, gamete intrafallopian transfer, zygote intrafallopian transfer, and frozen embryo transfer are included. A 4 to 6-fold increased risk of BWS in assisted reproductive technologies pregnancies have been reported. Most of these patients carry loss of methylation on the imprinting center 2. This finding points to a critical role of the pre-implantation phase of the embryo for imprinting establishment maintenance. To date, no specific assisted reproductive technologies procedures have been associated with an increased risk of BWS. All phases of assisted reproductive technologies, comprising ovarian stimulation, might influence genomic imprinting. In addition, it is unclear whether the high incidence of BWS in assisted reproductive technologies pregnancies is due to the related procedures or the underlying reasons for infertility. Management and treatment of Beckwith-Wiedemann syndrome. Patients with Beckwith-Wiedemann syndrome may require escalated care to manage persistent hypoglycemia and hyperinsulinism. Surgical repair of the omphalocele takes place after birth. The baby's overall health, the size of the omphalocele, and the degree of liver involvement determine the type of omphalocele treatment. Babies with small omphaloceles are monitored closely until they are ready to undergo primary repair. This means the herniated organs are placed back into the abdominal cavity, and the defect is completely closed in one operation. Macroglossia is one of the cardinal symptoms of BWS. In pronounced cases, macroglossia can lead to airway obstruction and functional deficits in feeding and speaking. Surgical tongue reduction is performed in this severe case at varying ages and with different techniques. Hemihyperplasia in BWS can cause leg length discrepancy. Leg length discrepancy treatment includes shoe modification, orthosis, or surgery such as arthrodesis or lengthening. Due to increased tumor risk in BWS, the European BWS Consensus recommends tumor screening for all BWS patients with the exclusion of patients with imprinting center 2 loss of methylation, advising only abdominal ultrasound every 3 months from diagnosis until 7 years of age. Another group suggested tumor screening for all BWS patients with both abdominal ultrasound and AFP dosage every 3 months until 4 years of age and renal ultrasound every 3 months until 7 years of age. Unless a child has had untreated low blood sugar or the above problems, including cancer risks, there's no indication that Beckwith-Wiedemann syndrome affects children's intellectual ability. Their life expectancy is usually average. Today, I discussed Beckwith-Wiedemann syndrome's causes, diagnosis, and management. Thank you for watching this video. See you next time.